First, many people worry that Christian therapists will substitute prayer and Bible verses for actual clinical treatment. Now, we might know that's not what we do, but the perception exists. And sometimes, unfortunately, it exists because some counselors operating under the Christian counseling banner really have prioritized spiritual advice over evidence-based therapy, or even just advice in general. When someone is dealing with clinical depression, trauma, or an anxiety disorder, they need more than spiritual encouragement. They need clinically sound, evidence-based treatment. The question in their mind is, will this therapist actually know how to help me, or will I just get told to read scripture and pray harder? Second, there's fear, the fear of judgment. People wonder if I open up about my real struggles, my doubts, my questions, my behaviors, will this therapist respond with clinical compassion or moral judgment? This concern is especially acute for people dealing with issues that intersect with theological debates. They want to know if they'll be accepted as they are, or if acceptance comes with conditions. Third, there are concerns about confidentiality. Some people have experienced or heard about Christian counselors who broke confidentiality by sharing information with church leadership, or who blurred the lines between therapeutic and pastoral relationships. They need assurance that you're operating as a licensed professional with strict ethical boundaries, not as a church counselor with different standards, professional ethics codes across all mental health disciplines, including the American Psychological Association, the American Counseling Association, the National Association of Social Workers, and even the American Association for Christian Counseling have established confidentiality as foundational principle of therapeutic practice. Finally, many people carry wounds from previous encounters with Christian counseling that was harmful, unhelpful, or unprofessional. Maybe a counselor minimized abuse, gave dangerous advice about medication, or focused on quick spiritual fixes rather than addressing complex psychological issues. These concerns are real. Even if none of this describes your practice, you still have to address these concerns because they're in the minds of your potential clients.